Good morning, everyone. It's your girl Happiness here again, and today I'll be bringing you a topic about kidney stone. Okay, for those of you who are visiting my channel for the very first time, I would like you to go ahead and click the subscription button below so you'll be part of every interesting activity and update that comes to my channel. All right, so let's get to it. What informed today's video, actually, a colleague of mine in the office came to me and told me, look, I'm having this serious issue. I said, what is it? You can talk to me. And he was like, I'm having kidney stone and the pain is so excruciating. I've been taking painkillers, but it's not helping. I don't have the money to afford a surgery right now. But someone told me there is this medication I can use, and he wrote the name since he couldn't mention it properly. It's Chanca Piedra, either Chanca Piedra or Chanca Piedra. Okay, he wrote the name and said, please do a research on this and tell me where to get it, how to get it, and if it's really genuine. So I was like, okay, I'll go through it. So that is what inspired today's video. So I'll be showing you a video just now, okay, on that explains what kidney stone is, causes of kidney stone, all about kidney stone. Okay, and after that video I'll also show you Dr. Victor's video from the Hams herbalist. Okay, he's a natural herbal doctor the herbal doctor that deals on natural product, herbal products. Okay, I'm also going to show you he's going to tell us about what Chanca Piedra is and how it helps with kidney stone. Dr. Victor is like I said, is a herbalist, a natural herbalist from the website www.herbaltrading.net. Yes, so let's get to it now, to the video.
A kidney stone can be as small as the head of a pin, almost invisible to the naked eye. But as every stone former knows, the pain resulting from this tiny crystal structure can be enormous. Inside kidney stone disease. Kidney stones, or renal calculi, are aggregates of crystals enclosed in a matrix that develop within the kidneys. They're classified according to the specific types of crystals they contain and fall into 5 major categories: calcium oxalate, calcium phosphate, struvite, uric acid, and cysteine. The most common is calcium oxalate. How is a stone formed? The first step is nucleation. Ions such as calcium and oxalate that have been filtered into the urine by the kidney spontaneously join together to form a solid crystal nidus. This is called nucleation. There are 2 kinds of nucleation. In homogeneous nucleation, crystals form around a nucleus with the same composition. Crystals of a different composition can also form around the nucleus. Organic materials, such as cell debris, may be deposited between the crystals as a matrix. This is heterogeneous nucleation. The tiny crystal formations travel down the nephron and are usually deposited at the renal papilla, where they undergo the next major phase, growth. Crystals that have already formed then begin to stick together, forming large aggregates. As we can see, crystals can aggregate very quickly. New stones are retained in the kidney, where they can continue to grow for an unspecified length of time until, for reasons that are not well understood, they are displaced and travel through the kidney into the ureter. If a stone continues to grow until it reaches a critical size, which can be as small as 4 to 5 millimeters in diameter, it may be too large to pass easily through the ureter. The edges of the stone may become wedged inside the ureter at the ureteropelvic junction, where the ureter crosses over the iliac artery, or at the ureterovesical junction. The result? Pain and obstruction until the stone slowly passes into the bladder and eventually passes out of the body in the urine stream. In the U.S., it is estimated that 13% of men and 7% of women will develop a kidney stone during their lifetime. Fortunately, in about 78% of these patients, stones will be expelled spontaneously. But stones that become lodged in the ureter may require lithotripsy or percutaneous or endoscopic removal. It's important to note that nearly half of all first-time stone formers will have another stone episode within the next 4 years. Recurrent stone formers are at even greater risk and may form a new stone every 2 or 3 years. But what actually causes crystals to form? Why do some crystals develop into kidney stones and others do not? One critical factor is supersaturation of the urine with stone-forming salts. Supersaturation is the driving force for crystallization. In undersaturated urine, crystals cannot form. The other important factor is a deficiency in substances called inhibitors. Inhibitors retard the nucleation, growth, and aggregation process by binding ions needed for crystal formation and growth. One of the most important inhibitors is citrate. Urine saturation and inhibitor levels explain why, in normal patients, large crystals are not formed. Their urine is not as saturated, and they have sufficient quantities of inhibitors present. But the urine of patients with kidney stones is more saturated. It may also lack inhibitors that increase the propensity for crystallization of stone-forming salts. There are 2 reasons for this. First, stone formers are known to suffer from a variety of metabolic disturbances that increase the amount of stone-forming substances excreted in the urine and also decrease the excretion of inhibitors. Second, a number of common nutritional and environmental factors can cause abnormalities in the urine. These factors may also exaggerate underlying abnormalities due to metabolic disturbances. Environmental stresses, for example, play a significant role in stone disease, especially factors that trigger excess water conservation in the kidney, such as inadequate fluid intake. Dehydration is a major cause of kidney stones, which is why people living in areas with high temperatures and humidity have a higher incidence of stone formation. A diet high in sodium is a double risk, because it increases calcium excretion and reduces urinary levels of stone-inhibiting citrate. Too much animal protein creates similar problems, encouraging stone growth by increasing urinary uric acid and reducing urinary citrate. Certain medications are also known to encourage stone formation or growth in susceptible patients, including common supplements such as vitamin C. There is no cure for kidney stones, but once an acute episode has been resolved, the key to therapy is simple: preventing recurrence. And fortunately, the most common stones, calcium oxalate and calcium phosphate, can be effectively managed with a combination of diet and lifestyle changes and medication. Compliance with proven management guidelines, such as increasing fluid intake and avoiding stone-promoting foods, can significantly reduce stone recurrence. Medical therapies, such as thiazide diuretics and potassium citrate, are also highly effective in appropriate patients and can reduce the need for expensive assisted stone removal procedures, such as shockwave lithotripsy, SWL. The economic burden of kidney stones is significant, with medical costs reaching billions of dollars annually. Effective management of this painful disease remains a key priority at Mission Pharmacal, the leader in innovative stone disease therapies.
Welcome back again. So now I'm going to show you Dr. Victor's view on Chanca Piedra and how it's going to help in taking care of kidney stone. Over.
Hi, my name is Victor, the Hamza herbalist, and today I'm going to talk about Chanca Piedra. Chanca Piedra in English means stone crusher. Chanca Piedra is an herb that grows in the Amazon. It's a whole plant herb. Everything is there: stems, leaves, vines. The whole plant is there. And Chanca Piedra has been used and is being used and has been used for a long time as a kidney cleanser. Okay, and it's been studied in Germany, actually. Commission E, which is a board of physicians in Germany who evaluate herbs, because in Germany they actually prescribe herbs. They've done a lot of studies on this, and one of the studies they did with 100 people, so it's not an in vitro study, it's actually an in vivo study, which means it's done on human beings. An in vitro study is one that's done in glass. So this is Chanca Piedra. This is what it looks like. It's just a nice herb, and these herbs are dried in a way to be able to preserve all the medicinal properties that are in it. Now, Chanca Piedra, what it does is it actually, even though it's called the stone crusher, it doesn't really crush the stones. Actually, what it does is it gelatinizes the stones, so that the stones can then take the form of the urinary tract, and as it does that, it's able to move down the urinary tract from the kidneys and be able to be expelled from the body through urine. Okay, it also is known to work with the gallbladder, and gallbladder stones will actually do the same thing. However, one of the things that you want to be careful, you want to work with your doctor when you do this, okay, is that you want to make sure that the stones in your gallbladder are not very big. This is a maintenance sort of thing. You want to be able to do this from time to time to be able to ensure that you don't have this kind of a problem. Chanca Piedra, the way to use it, one of the ways to use it, I'm sure there's many, is to make, you can make about a gallon of it, take about 1.5 ounces to 2 ounces, and you actually boil it for 15 minutes. And then after you boil it 15 minutes, you let it cool, you strain it, and you can add honey to it if you like, and then just put it in the refrigerator and use it as an iced tea. You want to drink 2 glasses a day, 2 8-ounce glasses a day, preferably 1 in the morning, 1 in the evening. And you do this for approximately 3 to 4 weeks. Now in Germany, they did it for 3 weeks, but I recommend 4 weeks in the United States, because we have a lot more product coming into our bodies that would create stones. So we have, I would say we have more of a problem with kidney stones than most other parts of the world. So this is the way you would prepare Chanca Piedra. And Chanca Piedra also cleans the liver. There's so many properties attached to Chanca Piedra, it's amazing. It works with so many things that I don't even want to take the time to get into those right now, because we would be here a long time. But there it is, Chanca Piedra. It comes from the Amazon jungle. Most of it is wild harvested. An excellent herb to clean your kidneys, your liver, and your gallbladder. This is the Hamza herbalist.
I'm sure you found them so educating and very interesting. So now the issue with those of us living in Nigeria is, how do we get hold of this Chanca Piedra easily? Okay, I'm gonna post a link down on the link box. I'll be posting a comment box. Okay, I'll be posting a link on where you can find the Chanca Piedra tea in Nigeria and use it for your health. Okay, that'll be all for this video. Hope you find it really interesting, and please, for the sake of love and care, don't forget to share this video to as many people as you can. A lot of people are suffering from kidney stone you might not know of unless they tell you about, and some will not even have the opportunity to tell you about it for you to know in the first place. So go ahead and share this video to as much people as you can to save lives, bring reliefs, and bring happiness to people. All right, see you all in my next video, and do not forget to click the subscribe button to be part of more interesting, fun, educational tips and encouragements that come to my channel. All right, see you all. Love you now, always. Bye. Mwah.